Welcome. Welcome all. We're getting started in just a moment. We're going to let everybody come into the session. Come on in. Welcome, welcome. Welcome, welcome. We'll get started in just a moment. Thank you so much for joining us today. Come on in. Please introduce yourself in the chat. We'd like to say hello to everyone here. Welcome. Yeah. I'm glad you're here this morning. We will get started in just a moment. We'll have interpretation in just a moment. There we go. Please introduce yourself. Thanks for being here.
Is wrong. Hi, everyone. We're going to get started in just a minute. Feel free to keep introducing yourself in the chat. I see we've got people from LA and San Francisco, San Diego, all across the state, which is exciting to see. All right, Bonnie, do you want to move forward with the interpretation slide?
Would you guys like me to speak, or you guys let me know?
Yes, go right ahead and explain the interpretation.
Okay, buenas tardes. Para accesar con su computadora, para interpretación a través de su computadora, por favor, primero, el número 1 en el control del seminario web, hagan clic en interpretación. Segundo, hagan clic en el idioma que desea escuchar español. Abajo será una opción si solo desean escuchar el lenguaje interpretado, hagan clic silencio el audio original.
All right. Bonnie, can you advance the slide?
Yes, just turned on interpretation, and now I will pull that up.
All Right. Well, I'm Wendy Nykirk Rhodes. I'm the Executive Director at Support for Families of Children with Disabilities in San Francisco. And we're going to talk today about parent engagement and peer support. I know we have some wonderful families and caregivers here today, as well as providers from a variety of different sectors and agencies. And what I hope we will all walk away from this from is a greater understanding of what's available for families and how to access that, and some ideas on what we can do in our own local places to improve parent support and peer engagement. You want to advance the slide, Bonnie? I'm joined today by some wonderful panelists who you'll hear from in the second half of the session. We have Amy Kai, who's our parent mentor coordinator at Support for Families, and the Cantonese speaking parent coordinator for SF Kids Collaborative, which I'm going to tell you about in a minute. Celeste Chacon, who's the parent mentor coordinator at Support for Families and the English speaking parent coordinator for SF Kids. Unfortunately, Glenda Padilla is taking care of a sick child today, so she's not able to join us. And then we have three wonderful families from the SF Kids Collaborative. We have Joy Shufang Ruan, Courtney Kingston, and Lillian Moncada. And so I'm really excited for the conversation we're going to have today. And I'm going to start by telling you a little bit about what's available and what we've experienced. I'm the parent of a child with a disability and complex medical needs as well. So when we're going through this, know that I am going through this with everyone, and we're all talking from the experience that we've had navigating these systems. You can advance the slide, Bonnie. Today, we're going to talk a little bit about why parent engagement and peer support for families and caregivers of children and youth with special healthcare needs is needed. We're going to highlight some existing programs that help increase caregiver support and access to services. Even if they're imperfect, they're what we have, so we want to make sure everyone knows about them. We're going to talk a little bit about our SF Kids Collaborative, which is an innovative public health approach to parent engagement and support that we are doing in San Francisco. And then we're going to dive into our parent panel discussion with the wonderful caregivers who we have here today. And at the end, we're going to have time for question and answer, and also maybe for some inspiration and ideas around what we can do in our own local communities to help better engage and support parents. Slide. So the first thing that I want families to know, and I hope we all walk away from today, is that you're not alone. It can feel so lonely and isolating and overwhelming parenting a child with a disability or complex medical need. Your experience as a parent is different. And sometimes the traditional supports that are set up for families and for parents, and the traditional advice that people give, and existing mommy groups or parent groups, they may not meet your needs all the time. Sometimes they can create a helpful community, and sometimes they can just highlight the challenges that you might be facing or the unique situations that you are journeying through with your child. And so I just want to take a moment to really say you're not alone. And I hope at the end of today's session, you feel more of a sense of community and also have ideas about where you can find community locally. It looks like we might have someone with their hand up. If there is a question, feel free to chime in. Otherwise, we'll have a Q&A at the end. All right. So why do families need support? In addition to just having a unique journey, families are navigating an exceptionally complex web for their child. Each child's journey and system of support looks different. But here's an example. The drawing in the middle of this slide is a care map for a child who has complex medical needs. And each bubble on the map is a different service or different provider. So imagine most parents who are working or parenting other children or have other things. And on top of just the daily grind of being a working parent or an at-home parent, you're coordinating appointments and services and medication and therapies in each of these bubbles every day on a regular basis. Additionally, your child probably needs a lot more physical support for you to support their medical needs or behavioral needs. And probably you are primarily your child's chauffeur, taking them to and from all the appointments that these bubbles signify. So for all of those reasons, parents are pulled in a very different direction and journey than many parents. But additionally, you're navigating all of these really dense bureaucratic systems. You have your local school district, your regional center, IHSS, Medi-Cal, Early Start, maybe your city or municipality, maybe local health plans, medical providers. The list goes on, and each one of these has a different application process, a different set of criteria, a different set of gatekeepers and ways that you access services. And they address a different piece of your child's needs. But there's not one place that addresses them all together. You're the person that's bringing that all together. So families feel alone, they can feel overwhelmed, and they can feel like it is literally a full-time job to meet their child's care needs, as well as the administrative assistant needs and transportation needs that their child might need to access all of this. Slide. So I want to go through a couple of the agencies that I just mentioned. For many of the families who are here, this is probably very familiar to you. Feel free to raise your hand and jump in if there's anything you want to clarify or something that's unique to your locality. But I wanted to make sure we just reviewed these briefly in case families aren't aware of them, but also for providers who are here to make sure you're aware of them. To get support around special education, which is typically delivered to children through IEPs in their school district, which are individualized education plans, families may need support learning about what's available, learning about services that exist, learning about how to get an IEP, how to ask for an assessment, and then what to do if you disagree with it, or you have other ideas, or you need support in connecting with your district in making sure that your child's IEP is followed. So there are some systems set up to help you access that. There's family empowerment centers, which are set up across the state. I included a link here, and the slides will be available after, so you'll have that as a clickable link. But family empowerment centers are here to help families learn about services, particularly around special education for their children in California. And it's a program that comes through California State Department of Education. There's also parent training institutes. Those are actually through the federal special education through IDEA. And we are one of these in San Francisco, but there are several across the state. They serve much larger areas, and they are really focused on helping parents learn about the IEP process. So those are the two main avenues that are available to help parents learn about and navigate special education. Slide. In terms of accessing regional center services, which is where kids access Early Start for 0 to 3, and then even once they're in school-based services, they may be eligible for Lanterman services throughout the rest of their lives. There's some avenues to help you if you're struggling accessing regional center services. First is in terms of accessing Early Start, there's a network of family resource centers all across the state that are focused on Early Start. And so you can access that through the FRCNCA site. And those centers can help provide navigation support, information about Early Start. You can refer yourself to Early Start. There's no gatekeeper in terms of a referral. You can just go on your regional center's website and complete a referral form, but also medical providers or childcare centers or other community agencies can help refer you to that as well. And then there's a variety of different services set up through DDS, which is the Department of Developmental Services at the state level, to help improve access to regional centers, because there's challenges and there's disparities in the way that families are able to access that. One of them is the Community Navigator Program, which is a new program which is designed for families who are approved for regional center services, but for whatever reason are not currently using them. It's especially focused, at least in our area, on Spanish-speaking families that are not able to access services. And this is really if your local FRC hasn't been able to help you navigate what you need, if you need more support, then the Community Navigator can really provide short-term, in-depth case management to help you access those services. Slide. And then obviously there's a lot of different supports available through Medi-Cal. Medi-Cal is the gateway to accessing a lot of services, especially once your child ages out of Early Start. And Medi-Cal is moving towards more care coordination and care management models. Two of the large ones are the enhanced care management model and the CCS and whole child model care coordinations. So this varies dramatically from municipality to municipality in terms of how it's administered and how you access it. But it's important for families to know that there is care coordination available. Sometimes you can access it through your medical center. Sometimes they have medical social workers who help a broad population. Sometimes it can be something more like CCS, which has very specific and limited guidelines on who they're able to help serve. But there are systems set up to provide support in families accessing Medi-Cal. Slide. And then there's other ways of getting parent support and engagement. Many municipalities have family resource centers. San Francisco has a network of 26 family resource centers. We are the family resource center that is specifically focused on the population of children and youth with special healthcare needs and disabilities. But what we provide is one-on-one service navigation support. We provide support groups and workshops and ways for parents to connect with each other. And although what we provide is more in depth than a lot of other agencies, there are FRCs in many agencies across the state. There's also Family Voices, which if you're here at this conference, you are familiar with in some way. But Family Voices specifically has a training called Project Leadership that is periodically offered throughout the state that helps parents to learn how to tell their story and become advocates for their child in terms of policy advocacy as well as individual advocacy. And then often many community-based agencies, schools, and medical centers have support groups that can be based on a variety of different diagnoses or disabilities or access to medical care. So I wanted to just make sure that we highlighted all of these. Before we move on to the next section, is there anything that any of our panelists would want to add to this, or any other supports that you would really want to make sure that other families or providers know about in terms of accessing services? And I can't see everyone, so if you have something, feel free to just unmute yourself and share it or pop it in the chat. All right. So then I'm going to tell you a little bit about a really exciting project that we're doing in San Francisco. Slide. We are the backbone agency for SF Kids Collaborative, which is the San Francisco Interagency Collaborative for Children and Youth with Special Healthcare Needs. The name just rolls off your tongue, which is why we have SF Kids as a shortened form of it. But what this is an effort to address the needs that parents have for engagement and support and the barriers that exist in accessing services in a family-centered way. And it is funded through a CalInspire grant at the State Department of Health. Slide. The mission of SF Kids Collaborative is to center the voices of families from historically excluded communities in partnership with providers to effect meaningful systemic change. Slide. This is a set of visual notes from our January meeting. And we love the visual notes because it really helps crystallize some of the challenges that families face and some of the goals that we have. There's language access, there's communication gaps, there's challenges in navigating systems, there's lack of follow through and what happens after you transition, there's unclear steps, there's challenges around language access and documentation and immigration status and so many different barriers that families face. And so some of the goals that this collaborative has raised are around training and creating plain language documents, creating process maps and resource maps that are available in multiple languages. For us, they're going to be available in Spanish and Cantonese and English. It's creating boot camps for kiddos who have complex medical needs to help their families learn how to provide care for them at home and to provide support. It's to address dental issues, which are such a huge gap in the system. And so the work that we're doing is obviously far-reaching, but what's exciting about it is that these priorities and these goals were brought by the families. So we have a group of about 25 amazing, engaged families who are participating in this work. And they meet monthly for an affinity space in their own language and monthly in a community gathering. At the same time, we have triennial meetings that include all of the agencies. We have over 60 agencies in San Francisco participating. And it's the family priorities that center the work for the triennial meetings and then also for the monthly work groups. We are 2.5 years into this work and we have we're about to start our final year of funding on this project. And it's really exciting to see this moving forward. And I actually just had another meeting this morning with the data work group, and we had the school district and the regional center and our local medical center all in the same room talking about data and how we can track some outcomes and better improve family access. But I want to talk today about some of the things we've done to engage families in this work and how they have been so invaluable. Slide. Some of the hallmarks of family support and engagement in SF Kids Collaborative and what has made this work is that we made sure to have affinity spaces in each family's language. So we host monthly affinity spaces in English, Spanish, and Cantonese. We also host a monthly community gathering to bring all the families together. And both of these gatherings we've done on Zoom because that is much easier for families to access right now. We also have monthly training, which usually happens in the community gathering space. And that includes everything from presentations around Medi-Cal or from DDS or trainings from the Office of Clients' Rights. We want families to know about services and also how to access them and what to do if they have a problem. We host family events in person periodically because we want to give families opportunities to come together in person with their amazing kiddos, just to have a fun time, but also to create connection and to foster relationships. We partnered with our local Department of Public Health to host trilingual focus groups to learn about what families' needs were. This was incredibly powerful for us and for the Department of Public Health, and it is actually going to be part of their 5-year needs assessment. We continually center the family-centered mission and priorities. Families know best what they need, and they know best the challenges that they're facing. Families are involved in the work groups. So when we have these detailed conversations around what systemic change needs to happen or how families can better access, families are part of those conversations and part of keeping everyone on task with their priorities centered. We provide stipends for families. This grant has been transformative in terms of being able to provide stipends. We currently offer a stipend that's roughly equivalent to $25 an hour for all SF Kids collaborative engagement that families have. That helps them to be able to better engage in the work, and it recognizes and honors the time that they're spending doing that. And then we also work to connect families to other support groups and training and events at Support for Families so that they have the support that they need when they're navigating services individually for their child. Amy and Celeste, is there anything that you would want to add to that, to what we've been able to do in terms of engaging families?
Thank you, Wendy. I think I would like to add something about the affinity space is the parents share their feedback is this space is kind of also part of peer support and kind of part of therapy, also kind of part of socialization session. So especially is respect their different culture, language. So they really appreciate that. Yeah, and for community gathering is the wonderful thing is the opportunity to bring 3 groups together. So everyone can learn from each other. We are different, but also the different make they're beautiful, and it's an opportunity for everyone to get to know more different group. Yeah, that's it.
Absolutely. Thank you for that, Amy. Amy is our wonderful facilitator for the Cantonese Speaking Affinity Group and does such intentional work in engaging families in that group. Thank you, Amy. Celeste, is there anything else you would want to add?
No, I couldn't have said it any better myself. Amy, that was a beautiful way to put it. Thank you.
All right. Slide. So now we're going to move forward to what we all are so excited about, which is our panel discussion. And this is going to be just kind of a round robin. So for our panelists, feel free to jump in whenever makes sense for you. And if we get stuck, then I'll call on one of you. But to start, could you each introduce yourself and tell us a little bit about your child and your family's journey and how you came to be involved in SF Kids Collaborative?
Okay, I'll start. My name is Lillian Moncada, and my kid is 18 years old. He was born with cerebral palsy. I've been part of Support for Families, and I've been doing this, like literally since he was born. I was lucky enough that the doctor, when he was born at Kaiser Permanente, introduced me immediately to support for families. And I have been part of, I call it my second family ever since.
I love that.
Okay, I could go next. Hello, I'm Courtney Kingston, and I have two children. Ben is 13 and Matthew's 11. And Ben has a genetic disorder called Smith-Magenis syndrome, and we had a really hard time figuring out what was going on with him. So our assessment exploration process lasted many years, and it was very lonely. And I think because I didn't know what was going on right away, I wasn't connected to support for families early on. But luckily, as the years went on and we got a diagnosis and I got my feet under me a little more, I was able to find this wonderful organization through a recommendation from a friend, and was involved in the parent mentor program. And through the parent mentor program, I was able to get involved with the SF Kids Collaborative. And I'm glad to be here today. Thank you.
Thank you.
Wendy, I'm going to next.
That sounds great.
Okay. Hello everyone. My name is Joyce. And I have a little girl. She's name is Arena. She's 4 years old. She is diagnosed with the name called PCH type 6. The one is the rare brain near disease. In the UCSF hospital in the Mission Bay. Now she's late development, and she need to do a lot of therapy, PT, OT, feeding therapy, speech therapy, vision therapies. It's a lot. She's busy. But she's still a happy girl, and she's going to preschool right now, and then transfer to the elementary next year. How can I know the support for family? It's referred from my another friend in another mommy group in the GGRC. I'm so happy she connect with support family for me, and I have very deep support from the support family. We have the same language group. We gathering every week and we talk with everyone together. So I feel so support with that. Thank you. And I'm very great to be here in the meeting today. Nice to meeting you guys. Thank you.
Thank you, Joyce. And Celeste, do you want to introduce yourself too?
Sure. Hi, everyone. My name is Celeste, and on top of being the parent mentor coordinator and SF Kids collaborative coordinator, I'm also the parent of a set of twin girls, one of whom has a rare brain malformation called lissencephaly, which essentially translates to smooth brain. So her brain doesn't have any folds or grooves. She's globally delayed and will stay around 0 to 3 months developmentally for the entirety of her life. So she is very medically complex. Um, and I heard about support for families through referrals from case managers, and it took me a while to get connected. And then once I was more in my advocacy journey, I was able to apply here and further my advocacy for families in San Francisco.
Awesome. Thank you all so much for being with us today. This is going to be an incredible conversation. Can you tell me about a time when you have really felt supported, or what support has looked like for you?
I can take that one to start. I think I went to a support group at Support for Families, and I think I only felt comfortable going there after I got a diagnosis, and our initial diagnosis was autism. And I didn't know many other people with kids since Ben was my first. Everyone I knew had kids around the same age, and being able to go to the support group and hear from families who had children who were older than Ben, so were further into the process and were able to give me so many recommendations and pointers about IEPs, services, how to get childcare, things like that. That was a time when I realized that there was support out there if I could just manage to hook up with the right people. So
That's great. It is. It's always tricky to find that first step or that first connection, but then it kind of can unspool and you can find another connection to another connection to another connection. What about someone else? What is a time when you really felt supported, or what did support look like for you?
I want to say for me, my kid is paralyzed from his neck down. The only thing that he's able to do is like literally move his neck. So it's very difficult to meet people that with kids just like mine. So I want to say to you, the first time that I was introduced to support for family, I was hesitant. I was like, no, because, you know, again, having a kid with disability, you go through different steps, like the denial. Oh, no, my kid is going to be okay. Oh, no. I think hopefully the doctor made a mistake, or maybe there's something wrong. And eventually reality hits in when he's not meeting the benchmarks, right? So with that, for me, meeting other parents that they come from a different path of life, and their, you know, their diagnosis is completely different than mine, but we're both, all of us are in the same spot one way or another. We have a kid that is special, that is disabled, and that's still our kid. So I want to say to you that definitely I felt the most supported when I met other parents, and knowing that I'm not alone, that these things, it's not that we chose to have a kid with a disability, is things happen, right? And getting feedback from others, because I remember meeting a parent, the former CEO of Support for Family. I met her and she was explaining and telling me about her journey. And she was the very first person that I met that her kid has same disability as my kid. Um, and again, knowing that it's not the end, it's just the beginning of a new chapter in your life. And I want to say to everyone who's listening to this, I'm just like any of you. I'm just a regular parent, just like you, that was lucky enough to come across Support for Families.
Thank you for that, Lillian. That's so powerful. And I'm glad that you were able to find support. And I know Juno, our former executive director, and her daughter are an inspiring duo. It's amazing to see what All Emoji has done and how Juno has been able to advocate for her. What about Joyce or Celeste? What is a time that that you felt supported, or what has support looked like for you?
Hi, when I'm feel supporting, let me share some story with you guys. Actually, Arena, she's born in the Las Vegas. It's not born in the San Francisco. When I am living in Las Vegas, she diagnosis 4 years old, and that's only one doctor for the neurology specialist in Las Vegas. And then I don't know nobody because I just moved from the Bay Area to the Las Vegas only 1 year, and then I have Arena already. I didn't have friend, I didn't have coworker, and then I feel so alone and overwhelmed in that moment. It's no one can help me. Either families, they are far away from me. So finally, we make a very big decision. Is move back to San Francisco, and then after we moved back, oh, is everything changed. I get the community connecting. I got GGRC, IHSS, and I got the very good medical resource from the UCSF Mission Bay Hospital. They give me a lot of support for either my mental health getting better at that moment. So I have more than I can say right now for this moment. I just very grateful. I make this decision to move back to San Francisco. Thank you.
That's great, Lillian. And yes, we're so lucky in California that we have so many different services and in San Francisco. And that's part of the goal of SF Kids Collaborative is to help those systems work together better for families, because it is amazing what a difference that can make. What about you, Celeste? Is there anything you would want to share about a time you felt supported or what support looks like for you?
Sure. I think similar to everyone else that has spoken, it's a very isolating feeling. And I had my children very, very young, and there were not a lot of friends or peer support that had children with kids in general, let alone with a diagnosis. So I think just being in these spaces with everyone makes me feel supported. It makes me feel less isolated. And I think in terms of provider support, I've definitely felt very supported when providers help guide me and don't try to take over. It's more so of giving me tools, recommendations, but creating a space where I feel safe enough to talk and share my thoughts. Yes, thank you.
Absolutely. I know Joyce already mentioned the impact that getting support has had for her, that her mental health, it feels better, that she really just feels like things are so much better. Is there anything that any of you would want to add about the benefit of giving support, or what's the difference for you once you get connected to support, whether it's through support for families or your provider or anywhere else?
Yes. I'm so lucky to connect with the GGRC and the Support for Family group. We are parents can work together within a small group. We have same language, same journey we are doing for, and we can discuss. We can learn more about the resource each other, can share more resource with that. We can build up the trust and the friendship with each other. So we are receive very good relationship to that. And the medical resource and the mental health with that. So I am so grateful and have the big support with this. Thank you.
Yeah,
Absolutely.
I agree, Joyce. I think especially early on when we didn't have the diagnosis, but things weren't really going like they were supposed to. And everyone else who had had kids seemed to be doing it a lot better than I was, and it seemed like it was easier. And I just had such a strong sense that I must be doing something wrong. I just felt very alone and really very depressed and didn't understand what was going on. And connecting with other people and hearing that feeling like a failure was normal, and that I wasn't a failure, and that other people were struggling in the same way. And just having a place to kind of be honest and open and grieve and put your all of your insecurities and vulnerabilities out, and then have them validated by a group of people who understand, made an enormous difference in my journey to getting through this a little more gracefully.
Wow, can I relate to that feeling like a failure? It is hard sometimes, and also having space to grieve, because your parenting journey and your child's journey might look very different than you had imagined parenthood. What about
I
anyone
also
else?
I also want to
Mhm.
say that we get a sense of belonging, because again, we
Yeah.
always talk about, we feel isolated, and getting a sense of belonging and getting a sense of, being supported by other parents. And also, learning how are we going to navigate the system? What do we do next? The kid is no
Mhm.
longer a toddler. Now he's going to school, he's going to preschool, then middle school. Again, and making the right decisions when the time comes, and of course empowering us as parents, so we can take the next step.
Absolutely. Anyone else? Anything you would want to add about the benefits of getting support or what the difference was for you?
I think similar to what everyone else has shared, just the mental load it kind of takes off of you, right? Like, I feel like when we are constantly having to navigate services, navigate care, and feeling overwhelmed, isolated, like a failure, and like everyone else said, grieving, it's a lot. It takes a lot mentally out of you, and it's draining. And when you get support and feel less alone, it makes all the difference. And when we are able to take care of ourselves and our mental health, it impacts our way to parent in such a positive way.
Absolutely. We're going to shift for a minute to talk a little bit about SF Kids Collaborative in particular. What would you say has worked well in terms of engaging families in this work? Because it really has been a sustained effort and requires a pretty significant commitment on the part of families. So what do you think has worked well?
I think the fact that we're a diverse community, that we have all different parents, we also have professionals all coming in together. I think that has definitely made a huge difference. Also making sure that every single one of our parents have a voice in the group, and by them, by any means, by providing translation, by making sure, like, if somebody has any questions, their questions get addressed immediately. We feel respected. It's like a trusted space where you feel so trusted that you can definitely, no matter what your title is and no matter who you are, we are definitely are able to express and be able to say, this is working and this is not working, we need to improve on this, we need to get better at this. I think that's what definitely has made a big difference.
Thank you for that. What about anyone else?
Right, the trust is very important. I feel if you don't trust, you distrust each other, you cannot share anything with other people, right? Like the support for family, Cantonese good. The first important thing for me is language, because my first language is not English, it's Cantonese. So if you want face-to-face community or phone communication with the same language, we can talk very deep with from my heart, right? So if you can talk very deep from my heart, you can build up the trust. Either you build up the trust, after that, you can share a lot of resource with that. So that is my situation right now. So I love to build up the trust and the friendship with other parents. Thank you.
Thank you for that. Yeah, trust is at the bedrock of everything, I think. And it's so crucial to being able to feel supported, because if you don't have trust, you don't feel safe being vulnerable and receiving support. Anyone else? Anything you would want to share about what has worked well in terms of engaging families in SF Kids Collaborative?
Sure, I definitely agree with what the other panelists have said. And then I think just logistically, being able to have it on Zoom is huge, because it's really hard to get out of the house when you have a child with special needs at home. And then the fact that the space understands that. So instead of feeling really bad if I have to step out for a few minutes because there's a meltdown going on, everybody knows and gets it. And so we're able to be supported in that way. And then also, I think just showing that what we're saying and doing is important by providing a stipend, I think that that's really nice too. You know, the acknowledgement that our time and input is valuable, because I don't think that we get that a whole lot. So I think those are a couple of things that have been very helpful.
Yeah, thank you for that. I know Glenda isn't here today. She also wanted to share that a lot of times parents are able to share resources with each other in their spaces in SF Kids Collaborative. That can also be a challenge, but it's really wonderful to see parents sharing resources with each other and giving each other advice. Is there anything else anyone will want to add? Then we're going to move on to some of the challenges. What would you say have been challenges in terms of engaging families in SF Kids Collab? I know trust is a big one, and it takes time to develop trust. And we've found that it's been important to develop trust among the families, but also there's a lot of distrust of agencies, and many families have been harmed by their experience in trying to navigate services for their child, or have encountered significant barriers that sometimes they haven't been able to overcome. And so trying to figure out how to work together in those situations has been really challenging. But what are some other things?
I think that some of the things that we mentioned, that the reasons that it's working are also the reasons that it's challenging. So it's great that it's on Zoom, but you still have a child with special needs that has a lot of things going on. So just having the time and the space to be able to do it can be a challenge.
Agree. I think the time and the space, another thing is language as well. If someone talk to you, for the beginning, I'm in the UCSF, arena at that time, when we got the diagnosis from the neurology, the doctor talked to me, oh, your child maybe not arrive over 3 years old. That is very, I feel very suggestible, right? I feel very alone, but nobody can talk to, can help on that moment. So if in that moment have have a social worker who speak Cantonese come with me, even talking to me, I feel help already. So I think the language is very important for me, for the challenge.
Absolutely. Anyone else? Anything you would want to share as a challenge? I know a challenge that I've had and that we've heard from many families is a fear about speaking up and being honest, because especially when you're talking to an agency or a medical provider, there could be a negative impact on your child. There's a fear about that. And it could be a perception, but also it could be a reality sometimes. And that's a scary fear. You're advocating because you want your child to have access to what they need and what they're legally entitled to. And sometimes you can be afraid that by advocating, your child might actually get less instead of more. And that is a scary place to be. And I think that ties into building trust. Any other challenges anyone would want to highlight? If not, what would you want families to know about how they can get support? And our audience is from all across the state. And so we highlighted some statewide opportunities at the beginning of this, but what would you want families to know about how they can get support?
I want to say that you're not alone, that there's a lot of services out there. We just need to know how to tap into them to maximize the full potential for the child, the siblings, the family. It's just sometimes, and I want to talk about people of color. We're so afraid of asking. And we're so ashamed, or well, I really don't know where to go. So I think just knowing that, you're not alone and there's a lot of services. And if you get a no, that's okay. That's okay. If it's a no, then we're going to keep asking, and the door might be closed, but we're going to open up a window, right? We keep knocking on doors and eventually we're going to get what we need.
Absolutely. I think that is one of the biggest learnings that I had as a parent is you might hear no and you might have to keep going back. In fact, most of the time you're going to hear no the first time you ask. It can be hard to access a lot of these services, and that is such important and empowering information for families to have. Also, if we could change the system so that you could maybe just get it the first time instead of having to keep going back, that would be even better. So we'll work on both at the same time. But what are other things you would want families to know about how they can get support?
Okay, I would say, use of pediatrician is very important to me. Because if they have some experience how to take care of the special need kids, either they don't speak same language with you. You need to come out with the comfort zone. Either you have the challenge with your language. You can call the interpreter with that. You can ask social workers for help. So that is very important to get the resource from the pediatrician. And of course, another thing I feel is very important to build the good relationship with your social worker and good communication with the social worker, because they can help you to get more resource, the community resource, and connect with you to another community organization, like support for family. That is very important. So yeah, Lillian says you are not alone. That's very important. You are not alone. We have same journey here. We together and the same train go to the same place. We do the same wheel. So it's very, very good to get the support with that. Thank you.
Absolutely. Anyone else? Anything you would want families to know about how they can get support?
I think similarly, trying to learn how to advocate as much as possible. So like Joyce said, your pediatrician that you go to for your child, maybe asking teachers, finding information on how to get a social worker, a caseworker, and then also social media. I mean, I know there's a lot of groups on Facebook, Instagram, Twitter, or X, whatever it's called now, I don't know. But there's definitely like using hashtags like hashtag CP, hashtag autism, and there might be some ways to find support that way.
Absolutely. It's amazing how much support there is available online. I know that has been transformative for me and helped me so much. We relocated from New York to California a couple of years ago. So navigating services in a new state was very daunting, and I was able to connect to a lot of different resources through people in groups that I met online. So if there's not anything else about what we would want families to know, what would we want medical providers, teachers, agencies, community-based organizations to know when they're engaging and supporting families?
I would say they need to know how overwhelmed we are. um, and just how, because of the emotion of having it be your own child, you can't take in information and process it the same way you could other information. So really breaking things down, taking it slowly, being respectful, and then I absolutely need it in writing so I can refer back to it after as well, because I cannot remember and absorb all of the information that I get during these different appointments. So that's one thing.
Absolutely. I don't have enough hearts to post on that, but yes, I fully agree with all of that. What about anyone else?
I think we want to be heard. You know, we want to sometimes there is a need of feeling validated. Like we have this concern, you know, like 2 months ago wasn't there. Can you like look into it? So we want to be heard. We want to feel validated that, you know, medical providers or whoever they're listening, right? That's what I would say.
100%.
I think one
Anything
of the
else?
things I think one of the things is having providers understand that when we come in and some of us have our walls up or aren't open and communicative, um, meeting us where we're at is very important. Some of us have had very poor experiences in medical providers' offices and have had to build up walls and essentially this tough skin in order to protect ourselves. And I think it's important when providers do the best they can to meet patients where they're at, but also the importance of providers taking care of themselves. Compassion fatigue is real. And when you're constantly serving diverse communities who are in crisis, experiencing crisis, and need immediate help, it's really important to do that self care so you can go in and support these families.
100%. That actually leads us very nicely into my next question, which is what are some of your top tips for families or even for providers to find support and take care of themselves?
I would like to say take one day at a time.
Mm,
We're definitely going to worry about what's going on today. And then we definitely, tomorrow, it's going to be tomorrow, but we got to take one day at a time. I also want to say cherish every progress, every little progress that your child makes. We definitely got to cherish that. You know, it's not like we're going to compare, oh, my kid is doing this, your kid is doing that. I think that's very important. And also take care of ourselves. We need to do some self-care. You know, we need to go, I mean, whatever it takes for you to bring down the stress level that we're under, we gotta do that. If it means going for a quick walk, reading a book, listen to music, doing some yoga, whatever it is for you, uh, taking 10 minutes, 15 minutes a day, or every time you have an opportunity. Because again, this work is exhausting. You know, having kids with a disability, being a mother, is exhausting. And having a kid with a disability, I want to say to you that it's twice as hard and twice as difficult. So I think taking care of ourselves and again, you know, cherishing every moment.
absolutely. What about anyone else? What would you say? What are some of your tips?
I would say knowing that you don't have to do everything all at once. I can remember a point where I was like, oh my goodness, we need this appointment and this therapy and this therapy and this therapy, and feeling so overwhelmed at the prospect of getting a comprehensive program going for my son and feeling like I was failing if I didn't. And I eventually realized that I could just focus on one thing at a time and we'd still be moving forward. And that was much better than feeling overwhelmed and almost having paralysis from not being able to prioritize and figure out what to do first. And then asking for help whenever possible. That's been a really hard one, but asking for help really does make a difference. I remember being in the car and I turned on the radio and I was listening to music and I was like, this is the first time I've had enough space in my mind to be able to turn on the music. And it just made me feel good. Like, oh, I'm making progress. Like I'm not so tense and so stressed out and really not present, because I'd been able to start to ask for help and yeah, get some more support. So
That is so important. I know my friends have kind of a running joke. I guess at some point I said, you know, don't turn down help, just say yes. And so our joke is always like, just say yes to help. Because many of us are, you know, we're strong, we're independent, we're caretakers. Maybe we work in careers where we're caretakers at agencies or as medical providers. And we're used to taking care of everybody else, but it's so important to just say yes and accept help when it presents itself, because we're juggling so much and it's important to take care of ourselves. What about anyone else? Do you have any other suggestions on tips?
Okay, for me, I would say it's very important to find a person who make you feel comfortable to talking to.
Mhm.
That is very important for me. Either this one not is your husband, maybe not your good friends, but a suitable person. It's very important for me to talking with her. Either she can help, but still she can help me to live. Thank you.
Yes. That's so important. And that person who's comfortable for you to talk to might be a therapist, it might be a partner, it might be a friend, it might be all of those. And so it is so important to find at least one or even more than one.
I just want to add to that one thing that I found about actually seeing a therapist. Not only do you have somebody to talk to and somebody listening, but your therapist takes notes. And so they can actually track some of the things that you're talking about, like when your child started this medication or when, you know, this behavior was a problem. And for me, it's hard for me to step back and see the big picture, and having someone else who knows some of this information is incredibly helpful. So that's been an unexpected boon of going to therapy.
That's amazing. That alone might encourage some people to access therapy if your therapist can help you track some of that, because there's so much to track. That's wonderful. Are there any other tips? If not, I have just one more question before we're going to move on to a little Q&A time.
I just wanted to add something very, very quickly. For taking care of yourself, I've never, like self-care, I've never been a fan of like when people are like, oh, like you should take a shower or you should cook yourself a meal or like things like that are basic necessities that we all should do for ourselves. But if you have like a hobby where you like to paint or you like to skateboard or ride your bike, like things like that can be very, or even if you like to just stay at home and like watch a show, watch a trashy TV show, things like that can be very therapeutic.
Absolutely. That's such a good point. My last question for our panelists today is just what brings you hope for this journey? We're all on a really unique journey with our child. What brings you hope?
I think that we're not alone. There is a huge community of people ready to support one another. We are where we are right now because people, parents before us started this work. And I think in my case, I want to say that it's on me to continue and make sure that we improve the quality of life for kids with disability and people with disability. I think that's what brings me hope in this journey. It's only going to get better. We're going to hit a few bumps here and there, but it's going to get better.
Absolutely.
Okay, I go next.
Anybody else?
Yep. I very agree with Lillian. You are not alone. That is very important. I feel somebody traveling with me, who family like this. And then I will feel my daughter and me got the support from the family, community, and the government. So that bring me for help.
Absolutely.
I agree. Just
Oh.
knowing that there's organizations like this and spaces like this where we can be supported, not feel alone, feel strong because you have a framework to be moving toward a better future. And that's not all on you by yourself. And then also just the experience of living through some of those lowest, darkest times and getting through to the other side and seeing some progress makes it easier to stay hopeful. Wow, this is impossible, it seems right now, but it seemed impossible before and we made it through and we're going to make it through again. So that's another thing.
Absolutely. Anyone else? Anything you would want to share about what brings you hope on this journey? If not, we're going to move into our question answer time. I know there was a brief question earlier around support for siblings, which is such an amazing question. So I want to highlight that there is trainings that many agencies offer that are called SIB shops. And they're a place that are like a support group for siblings of kids with disabilities and complex medical needs. Celeste actually went to a training for that last week. So I'm going to turn it over to her for a minute if there's anything that she would want to share.
Yeah, so just really briefly, it was an amazing training. And as I mentioned, I have a set of twins. So, developmentally, they're supposed to be at the same level. And the interaction is, I do my best to support my neurotypical daughter. And I think that the SIB shop provided a lot of videos and tools on how to support children and also a lot of like research. There's Thank you, Wendy, for dropping that in the chat. There is no denying that siblings are directly impacted by having a child with a diagnosis or having a sibling with a diagnosis. And one of the things mentioned, which I think is really great, is like at the end of the day, when everyone's getting ready for bed, just taking 15 minutes with that sib and just talking about their day. That 15 minutes can make a huge difference and a huge impact for them where they feel like they have you just to themselves. yeah, that's all I'm going to say on that. I don't know if anybody else wants to touch on it because I know everyone has experience, or everyone in here has experience.
No, that's such a powerful point, Celeste. I know with my kiddos, that has been really important to make sure that each of them have time where they're getting the attention and they're getting my full focus and engagement with them, because it can be really hard. There can be a lot of different things that siblings navigate. And one of them can really be that your parents are pulled in a lot of directions supporting your sibling. Is there anything anyone else would want to add around sibling support?
I definitely agree, giving individual time. I think having time to talk about some of the challenges too, with them, you know, having open conversations about, yeah, was that really difficult when Ben, you know, tore up your thing the other day? And how does that make you feel? And pointing out when things are really nice, like, wow, Ben gives better hugs than other brothers that age. So having an open dialogue about it, and my kids are pretty close in age, 11 and 13. So what's fair comes up a lot, and that's a hard one. And part of it is me alleviating my own guilt. Like, yeah, it's not really fair. And that's the way it is. And it's always going to be like that. And you're really smart and strong, and you're gonna get through this. And you're gonna need to accept it as part of it. You know, this isn't going to change. So I'm trying to get Matthew into therapy. I've tried a couple of times, and he goes back and forth between being more open to it and not, and resisting the urge to do everything as a family activity and being like, nope, it's actually better if we don't do everything as a family activity and just have one child sometimes and just have the other child sometimes. Because that one-on-one time for either of them makes a big difference. So
Absolutely.
Okay,
So
Wendy.
now uh-huh.
Oh, sorry, I interrupt you. Okay.
No, go for it.
Finally, I want to say one more thing. Even you feel you are in the dark right now, but just don't give up, because once you're ready to open yourself, you will get the connection. Once you get a connection, you will see the line from the tunnel. So just don't give up. Be strong. Thank you.
Thank you for that. I love that. So now we have some time for questions. If you have questions for our amazing panelists, you can pop them in the chat or use the question and answer function in the webinar. While you are typing up any questions you might have, I just want to say thank you again to Amy and Celeste and Joyce and Lillian and Courtney for being here today. I also want to say thank you to Laura, our interpreter, and to Bonnie, who is doing the tech support behind the scenes, making all the magic happen. If you don't have questions, that's fine. I have something else. We'll do it for a couple minutes. But if you do have questions, this is the moment to ask them. We have a question that says they were in a different breakout session and would like to see this later. I don't know if the breakout sessions are recorded or not. That is an excellent question. I don't know if Holly is on here right now, but if not, we will get back to you with that answer. Any other questions? Someone just said they asked earlier and they said yes. If we don't have any other questions, we have, I have to do math. We have 8 minutes until the closing session for today. And so I wanted to give us all just a moment to do a brief breathing meditation so that we can take a moment. This was a lot of ground that we covered today. And I know I need a minute to process this and just kind of take care of myself. And so I'm hoping that we can do this all together. And Bonnie's going to share this right now if she can get the video up. Is it going to share the audio, Bonnie?
If I unmute myself, do you hear it now?
I hear you, but I don't hear the video.
Okay, give me
Hear the
one moment.
video.
We
Sorry?
may just have to pop the link in the chat for you all to do this on your own. Oh, you can hear the video. I just can't hear it. So great. Start the video then. It's
Okay,
me.
awesome. Let me share my screen one more time.
Deep, mindful breathing relaxation. You can sit comfortable in a chair with your hands on your lap or lay on a mat on the floor if that's what you prefer. You may close your eyes to help you relax if this is okay with you. I would like you to sound your breaths. It will help you disconnect from intrusive thoughts and it will induce relaxation. We will take 5 deep breaths, inhaling to the count of 5 in your mind, holding your breath to the count of 5 in your mind, and exhaling slowly to the count of 6 in your mind. If this is too much for you, you can do it at your own pace. Let's begin. Take your first deep breath. Fill your lungs fully and hold it. And out. Push all the air out. Breathing again. Deep breath and hold it. And out. Push all the air out. In again. Fill your lungs fully and hold it. And out. Push all the air out. In again. And hold it. And out. Last breath in. Deep, deep breath and hold it. And out. Now breathe normally. In and out. In and out. Your mind is more calm. Your body is more comfortable. With each breath you take, you can feel the quiet inside. Just stay in the moment and keep breathing. Keep breathing. Nice and relaxed. Nice and relaxed. Nice and easy. Feel how the cool air enters your body when you inhale. And when you exhale, you put a little bit of your warmth into the world. With each breath you take, imagine that every cell in your body is at ease. And keep breathing. Just keep breathing. Nice and relaxed. Nice and relaxed. Nice and easy. Keep breathing. Nice and easy. Nice and relaxed. Keep breathing. Keep breathing. Now you can gently open your eyes. Your mind is clear, calm, and refreshed. I hope you enjoyed this relaxation. You can do this exercise anytime you need to relax. I'm looking forward to sharing more meditations with you. Remember to take mindful pauses every day to distress, rewire, and reset your brain. You need a healthy mind for a healthy body and a healthy life. Thank you.
Thank you, Bonnie, for sharing that. And thank you all for being here. I want to say thank you one more time to our panelists, to Lillian and Courtney and Joyce in particular, and Celeste. Thank you for Amy, for Laura, and for Bonnie. You should be able to join the 1:30 closing session for the Health Summit now. But I hope that in today's conversation, you learned more about what is available to support and engage families, and that if you are a family or caretaker for an individual with complex medical needs, that you feel supported and that you had a moment to find community today. Thank you so much for being part of this Health Summit, and I'll see you over in the closing session.